This is part 3 of the case that we filmed yesterday with a posterior glide shift at the pubic joint. And in the middle of the night, our client felt like her familiar left-sided SI pain returned, and she describes it in mechanical terms. So I reevaluated everything, and I was happy to find that the pubic joint maintained appropriate position, mobility, and stability. If you look at what is possible in terms of other patterns when the pubic bone shifts, you'll see that there is opening, especially of the lower SIJ on the left side, and there's a little opening in the right side SI, more so on the upper half, upper anterior portion. And the pattern she presented with today was in fact different, which is a good sign, because if treatment is correct, the pelvis may undergo permutations. So it's all part of the basic pattern, and that in fact is what happened. And what she presented with today was when her body is fully flexed, the sacrum goes into a torsional pattern, which is not driven by her hips. You can get a false positive looking for a torsion in the presence of asymmetrical hip motion. But in this example, it was a true torsion. So we treated restricted mobility and prominence of the left lower quadrant of the sacrum, which in osteopathic terminology is called a left rotation on a left oblique axis. In Hesch terminology, it's called a prominent and stuck left lower sacral quadrant. So we had her do self-correction on that, and we'll never have to treat it again. She'll be independent in treating it herself. After that pattern restored normal mobility, and the L5-S1 facet joint had normal mobility. The remaining pattern was a posterior glide of the left ilium, and that's a description in the Hesch biomechanical model. And so we treated that, and at that point the pelvis had normative mobility and stability in neutral and in full flexion, which is yoga child pose position, and then we looked at the rest of the body. And that took us to the upper cervical spine, and we had a rather fascinating response to restoring mobility at the OA joint, and we restored several directions of restricted mobility. And after that, I retested her ankle mobility, and her ankles were very stable. So this is the third case that I've seen in which we do upper cervical work and improve strength distally. So somehow that pattern was causing inhibition that may have influenced different parts of the body, but certainly influenced the perineal muscle group. And so I'm just going to ask the client to share with us, her response to today's visit. Can you give us your thoughts?
Well, I'm thinking that adjusting C1 may have been indeed a key to hopefully achieving stability even in the lower lumbar spine and the sacroiliac joints. I certainly feel much better after that adjustment.
And you had been getting some adjustments in the upper cervical spine, correct?
Correct, yes. But they were not holding long term.
And in response to today's treatment, how do you feel?
I feel very good, but usually with me time will tell, but I feel very good as I'm standing here.
And so how does that compare to when you walked in?
Well, when I walked in, I was in pain and in various parts of my body, most notably the left SI, but I feel much better than when I walked in, certainly.
Do you feel empowered to treat the cervical spine and the torsion pattern of your pelvis?
Yeah, you gave me some exercises to do, and I can start doing those, and I think those are going to be helpful.
So tomorrow's visit number 3, and you came in from Montana to see me, so tomorrow we'll wrap it all up and give you a film that will teach you everything that we want you to do to maintain the benefits.
Great.
So, thanks so much. I appreciate it.